Hey, it's Seth Rojas with your daily reminder that healthcare is not expensive. Well, there's some parts that are expensive, but it's not the doctors, it's not the nurses. It is the health systems, and it is the government, and it is kind of the combo of those two, which we're going to talk about today. All right, so here's my big beef. So we had a conversation today with a huge health system in the tri-state area, right? We got customers all over the tri-state, and I want to help them pay less for their medical treatments. But I can't always do that on more complicated cases, right? Because it requires a health system. It just does. Like, there are inpatient things that I can't do. Well, so this health system wants me to take the prices for the big stuff, but then they want me to use them for the little stuff. All right, now, you might be saying, how did we get here? In 2011, the US government, with the support of all the voters, decided that physicians should no longer have ownership in or of hospitals, right? So like the American voter decided, hey, we don't want the best outcomes anymore. We don't want the highest quality stuff, and we sure as crap don't want the lowest prices. It's kind of ridiculous. I actually used to give the benefit of the doubt and say, the American voter didn't know what they were supposed to do, or they didn't know what they were doing, or they didn't know anything about the law. But we've done a bunch of Twitter polls and a bunch of LinkedIn polls, and about 60% of people go, yeah, I knew that was a rule. You know, I like that a car manufacturer can own a car dealer, Tesla. I like that, a lawyer can own a law office. But I don't want any doctor owning a hospital. Those greedy people. Yeah, well, guess what? That's all, it's junk garbage. 99% of most doctors, there are some who are crazy about the money. Most of them don't go to school for 15 years, take on a bunch of debt, hang out and study while the rest of us are having a great time making babies, getting married, and getting our jobs. They don't do that, right? Like, that's not what happened. That's not why doctors go to medical school. It isn't to get rich. I've not really ever met a rich doctor. Okay, far be it from me. What I'm trying to tell you is the law sucks and the voters did it. Here is the truth. Healthcare is not expensive when you go to a physician-owned facility. Here's the difference. Grab my trusty notes here so I make sure I get it just right. So the health system in the tri-state, total joint replacement. Here's the best price, right? Because I want them to do the big stuff, crazy, high acuity, brain tumor, drill in the head, just stuff like that. Their price for a total joint, that's a knee or hip replacement. Everyone knows? $65,035.60. Now imagine a little analyst like me. Get their numbers right. Okay, but here's the problem. Okay, so remember 65,000. I have physicians in the tri-state who own their own surgery centers, because those weren't banned, just hospitals, who do total joints for $22,000 to $25,000. So if you live in like New Jersey, New York, why would you pay $65 at a hospital system with a bunch of COVID patients in there and like some crazy communal disease when you go to a beautiful ambulatory surgery center run by professionals and pay $22? Nobody wants to do that, right? So I'm not paying $65. Well, it's not really me that pays, but you know what I'm saying. Like, we're not going to agree to that. Number two, CT of the abdomen and pelvis without contrast. One of the most popular CTs in the country. Like, I think it might be number one. It might be. $1,948. Who in their right mind is going to pay $1,948? Nobody. Our price, not 1 minute away in a drive, right? Like, you got to go downstairs out of the hospital into the garage, drive over to this other place, $218.75. $218.75. That's $1,700 less. All right, labs. Let's pick on labs because everybody knows that I love to talk about labs. 15 billion labs are consumed, and I think it's a huge way to reduce your medical spend. I don't care if you're a health share. I don't care if you're a health plan. Like labs, they constantly get you, and I'm going to show you why. The health system in the tri-state wants to charge $314 for a complete metabolic panel. You know what we pay? Including lab draw. Because I didn't look yet, but I'm certain that there's a lab draw fee that's going to be in addition to the $314. We pay $9.12 to $14.24. Give me a friggin' break. Now, what do I want to really say? I want to say, when you're a self-funded health plan or you're a health share member and you need a surgery, a procedure, a something, you could call us. I'll put our 1-800 number up. We can help you. And find a physician-owned facility. Higher quality, right? So like less readmissions, less mess-ups, less everything. Lower infection rate, super important, like significantly lower. So higher quality. Lower prices, like by a third. 65,000 divided by 3 is almost 22. Lower prices. And you're not in there with all the sick people, right? Like you go to NYU Langone, you go to Atlantic, you go to wherever in the tri-state, like sick people everywhere. You don't want to be there. You want to be at a physician-owned facility. Now, Rojas out, done with this.